Stop. Okay. Just make sure. All good. So, good afternoon, everyone. My name is Wendy, and it is my immense pleasure to host this very first live stream for Stoney Health. We wanted to start these as a bit of a way to let you know the faces behind some of our programs, as well as offer an opportunity for us to kind of speak about some current trends in health and give you some more information in a different format than we normally would. Today's topic is a really juicy one and obviously very relevant for what we've been going through for the past 18 months. We want to tackle some vaccine myths around COVID, and joining me today is our acting community health nurse, or acting manager of community health rather, Katie Hilton.
Hi.
So, Katie.
Hi, thank you for having me.
Great. And so this opportunity is going to be, there's a lot of information out there right now around COVID vaccines, both factual and not true. And we really wanted to tackle some of these concerns that you have and encourage you to really get vaccinated. It's so important for our community, the community's health, and really for us to get back together with our family, friends, and get back to the social activities that we love to do. So let's kick it off. Here's our very first myth that we're going to tackle. The COVID vaccines are not safe because they were either rapidly developed, emergency approved, or not thoroughly tested. There's not enough time to show the long-term effects. We've heard this from a number of people, and I'm going to pass it over to Katie, and she's going to give you a great response.
Okay, so here we go. So in response to that, I would say that obviously pharmaceutical companies have invested huge amounts of resources into developing the COVID vaccines as quickly as possible. And due to the worldwide effects of the pandemic, an emergency response was needed, which is luckily exactly what happened. This doesn't, however, mean that safety protocols or testing was bypassed. When Health Canada approved any of the vaccines that we use within Canada, they carefully studied the data, which covered areas such as safety, efficacy, which is how well they work, and quality. And there are a number of reasons why the COVID vaccines could be developed so quickly, which includes over 30 years of existing work and development on the vaccines that we have now that are suitable for coronavirus. So people often look at like the new types of vaccines, the mRNA, and I say new kind of in inverted commas really, because they're not technically new. The actual technique has been being studied for 30 years now, but we haven't had a reason to use the actual technology until now. So we're actually really lucky that over the last 30 years, scientists have been working on this technique so that it can be used when we have this pandemic right now. So no steps were skipped. And in fact, the developers really cleverly worked on conducting some of the steps on an overlapping schedule, which enabled them to gather the data that they needed to get these vaccines to market faster. And then finally, because COVID is so contagious and widespread, it really didn't take long to see if the vaccine worked for the study volunteers. And actually, the initial studies actually had the largest number of study volunteers for any medication or vaccine ever developed anywhere in the world, along with huge sums of money from governments around the world. So ordinarily, vaccine developers would spend years stuck in limbo, unable to conduct their trials or progress to actually having medications or vaccines on market because they have to wait for funding, they have to apply for grants. But in this situation, because we needed to find a solution really quickly, the researchers, the vaccine developers, the scientists had money thrown at them from governments around the world, which enabled them to bring it to market quicker and get us to the point that we're at now.
Great. We initially intended this session to be live on Facebook as well, but unfortunately, due to technical issues, we've had a bit of a glitch. We hope to iron that out for next time. So if you do have questions as you're watching this, please feel free to send them to us. I'll leave contact email for us and reach out at any time. And if you have ideas of other live streams that you'd like us to do in the future, please let us know. So the next myth we're going to take on is For those of you who've already had COVID and you've recovered, thankfully, yay, you may be thinking, hey, I don't really need to get the vaccine. What would be your response to that, Katie?
So the first thing I wanted to say was that there was a kind of a commonly held belief up until very recently that you had to wait 90 days until after you'd recovered from COVID to get the vaccine. There is no longer any mandatory waiting period between having COVID and being immunised. So like I say, previously we did advise 90 days, but this is no longer necessary. And if you have had COVID and you want to get vaccinated, obviously you need to complete your isolation period and recovered and have no symptoms before you do come in and get immunised. Now, what we do know is that obviously some people do have a degree of natural immunity when they've had COVID, but some people actually don't develop any natural immunity at all. Sometimes it just depends on the amount of the virus that you had, so what we call the viral load. So if your viral load is quite low and you had a very mild case of COVID, you may not have developed antibodies. So not everybody develops antibodies. And we know that what we call this natural immunity, we know that natural immunity doesn't last doesn't last very long in some people. In others, it will last longer. And we are seeing some people who 10 months out have still got some degree of natural immunity, but it doesn't last forever. So it's really important to make sure that you are protected with the vaccine, just to boost that natural immunity to prevent you from contracting COVID again, or if you do contract it, becoming seriously ill with COVID.
Great. The next one is a real juicy one. We've heard this in the media. There's so much information out there right now, but there is a bit of a myth going around that more people will actually die as a result of the negative effects of COVID vaccine than will actually die from the virus. What would you say to a patient who came in and asked you that?
I think there are some people who've seen kind of some of the stories and kind of, I suppose, conspiracies online, which kind of say that there is a cover-up of COVID deaths and that people have died from having the vaccine. There is a system, an adverse reporting system that is predominantly in the United States, where people can access and see any deaths related to anybody who's previously had a vaccine at any time. Now, what we are going to see is, because there are so many people who are having the COVID vaccine at the moment, that it has to be reported if somebody's died within so many days of having a vaccine. But that doesn't necessarily mean that that person has died from that vaccine. That person could have died from something else. It could have died from a heart attack, from a stroke, from having cancer. So it could be from anything else. It is purely coincidental that it's recorded there that they had the COVID vaccine. And what we've actually found with the vast majority of those cases as well is, after a period of time when they do the investigation into the death and they do what's known as a post-mortem, that actually we're seeing that it wasn't the vaccine that was the cause of the death.
Great. Yeah. I mean, there's so much sadly, for lack of better ways saying it, conspiracy theories around this vaccine. We really, and that's one of the reasons we really want to do this today, is to make sure that we're hopefully providing some factual information for people to make really the right choice for themselves.
And I think when you look at those numbers as well, people might look at a number and say, oh my God, 6,000 people. But when you think of the billions of people around the world at the moment that are being vaccinated, 6,000 is a very, very small number in comparison. But like I've said, the vast majority of those aren't in any way related to the vaccine. It's people who've died from natural causes or from illness that they already had.
This is a valid concern amongst some people, that the vaccine was really developed to control the population, either through a microchip somehow in the fluid of the vaccine, or quote unquote a nano transducer that's being implanted in our brains through the vaccine. So what would be your response to that?
There is no vaccine microchip. The vaccine will not track you. It will not gather personal information into a database. I have seen pretty much every vial of vaccine that we have here in the health centre. There are no microchips in there. We are not uploading any personal information of anybody directly to the government for them to track you. And you know what? I think just go back to the whole, we have cell phones that have things like our banking details on there that can track our movements. So, if the government wanted to track us, they could do that very, very easily through our cell phones.
Yeah. I mean, it's funny, but, you have to, understand that some people may have that concern. And
some people are honestly worried about that.
Honestly worried, yeah. And so that's why we're here to help, hopefully give you some good information. Yeah. Now, this is one that's probably near and dear to your heart, given that you're a maternity and infant expert in this field. What if a woman comes up to you and says, I'm considering getting COVID, but I'm either considering getting pregnant, I am pregnant, or I'm breastfeeding. What sort of advice would you provide that to a patient of yours?
So if you're pregnant, we do strongly advise you to get vaccinated. And this is particularly important with the new Delta strain. Around the world, they are starting to see increasing numbers of pregnant women admitted to hospital. So in places where they have got the Delta quite prevalent, they are seeing increasing numbers of pregnant women admitted to hospital. And obviously during pregnancy, your lung capacity is somewhat reduced, partly because you've got that growing uterus and baby. So everything's kind of pushed upwards, the lungs are pushed to the side. So if you do get something like COVID, because your lungs are already a little bit compromised by being pregnant, you can become more severely ill. And we also know that when you're pregnant, your immune system is somewhat suppressed. So again, you're kind of more kind of open to being able to get illnesses and things during pregnancy. And like I said, you are at more risk of severe illness as well. So we want to prevent that. And this advice also applies to breastfeeding mothers and women who are trying to get pregnant as well. I am just going to say it is important to note that we do have minimal research around pregnancy and breastfeeding and COVID vaccines. And that doesn't just apply to the COVID vaccine, that's for any medications, just because it's not ethical to do research on pregnant women or breastfeeding women. So we do have minimal research, but it's important to know that this advice to actually get vaccinated is based on good clinical advice from highly experienced professionals and based on what we're now starting to see around the world with regards to pregnant women and the increased risk of hospitalization.
Okay. Thank you. So just, we have got a couple more that we want to address. This kind of ties back to the microchip transducer idea, but there's been some concerns that the vaccines themselves contain maybe toxic ingredients that could really harm someone. How would you respond to that? So,
well, I know the ingredients in the labels of vaccines can look really intimidating. When you pick them up and you read them, often you can't even pronounce, the names of the ingredients that are on the label there. But many of these ingredients are actually found naturally in our own bodies, in the foods that we eat, and the environment around us. And the amount of these ingredients found in vaccines are very, very small. And it's important to note, as I said earlier, that vaccines are tested and go through rigorous and lengthy scientific trials, as well as certification processes worldwide. So not just with Health Canada, you've got with the CDC in the United States, the FDA, the World Health Organization, and that's to ensure that they are safe and effective. And I've actually got a really useful diagram that I will forward to you, Wendy, which shares and we can share it in the comments of the live feed afterwards. And this breaks down really simply the ingredients included in a vaccine and how each one works and what the purpose of each one is. And it's really interesting to see how some of those are just naturally occurring in our body as well.
Yes, we'll share that. We'll make sure it's included in the comments at minimum. And so maybe this is perhaps our most important myth or message that we want to leave with people. There's a lot of concern right now, particularly as we're in the fourth wave of COVID, where it's been termed the fourth wave anyways, that the vaccines aren't working. And that vaccinated people are in fact testing positive for the current Delta variant that is becoming the dominant strain of the virus. What would be your response to those patients' concerns?
Yeah. So we know that vaccines are highly effective against severe illness and death. And this, the strain of COVID caused by both the original strain and the variants we currently see. We do know there is a very slight reduction in efficacy, so how well it works against the Delta variant. However, what we do know is that the vaccine is highly effective in preventing serious illness, hospitalization, and death. And we do know that because of the reduced risk of contracting COVID, that it also slows down the transmission of the virus. So if the virus has less people to infect, it starts to die out. And a great example at the moment is to look at the United States. So 95% of the people testing positive for COVID right now, and the deaths that we're seeing, are in unvaccinated individuals, and the majority of cases are in states with low vaccination rates. So for example, Florida and Texas. Some variants, particularly the Delta variant, do spread more easily. So in fact, the Delta variant is actually 10 times more contagious than the original COVID strain. And getting vaccinated obviously can save your life and prevent you from having serious illness, and also, importantly, prevent you from passing COVID onto someone who can't be vaccinated or someone who is still high risk of serious illness. And I know that we hear frequently in the media comments around whether the vaccine works, because some people who've been vaccinated have still contracted COVID. And I suppose what I want people to understand is that no vaccine is ever 100% effective. The same with many medications, but we still have that really high level of efficacy. And there will always be breakthrough cases because some people are still high risk despite being vaccinated. So they might have a compromised immune system due to something like cancer or an illness. So others around them being vaccinated will really help to protect those people. And like I said, if you do happen to be one of those very rare breakthrough cases, you're not going to become seriously ill with COVID and be hospitalized and have that risk of death, because you will be much more likely to have a mild version of the illness. And what we're really starting to see now around the world with this fourth wave, which I should just say that Canada tends to be a little behind the rest of the world. So we have a bit of time on our side, so it's really important to get vaccinated now. But what we're really starting to see is that this is becoming a pandemic now of the unvaccinated, because the vaccinated are getting much more milder illness. So like I said, we have some time on our side now to prepare ourselves before the fall and the winter season, when we will inevitably see a rise in cases. So I suppose just my kind of final point that I wanted to say is that obviously if anybody has any questions or concerns related to the COVID vaccines, the nursing team at Stoney Health Centre are always available. You can call us at the health centre, you can drop in to speak to us if you want. We have walk-in vaccine clinic every Tuesday from 11 a.m. to 4 p.m. and pop-up clinics around the community every week. So you can watch social media for those locations and dates. And then just finally, stay safe, get vaccinated, protect those around you, and we will see you soon.
Right. So yeah, thank you, Katie. Thank you for the time spent answering some of these questions. And I just want to say that, it's our pleasure to bring you this this stream. It's something new for us to try. And as I mentioned earlier, please, if you have questions or topics that you really want us to address, we'd be more than happy to have them, to do them as a future topic. And as Katie mentioned, if you have specific questions around vaccines, COVID vaccines, or really any health matter specific to your certain case, please don't hesitate to contact the health center at any time. Our professionals are waiting for you in the community. We're here to help you. We're here to support you. I guess we will watch on Facebook and our other channels, as we will be hosting another one of these in a couple weeks, unless before then some timely topic comes up that we feel we should do an emergency broadcast. But otherwise, thank you for your time, everyone, and we look forward to seeing you virtually again. Bye.
Thank you very much. Bye.
Okay.